Hello everyone, I am Vibhalal, working at Choitram College of Nursing as assistant lecturer, and today in this lecture we are going to study about blood component therapy and its transfusion. Before starting our topic, let's go through the objective and content of our study. So let's begin with the objective. Objectives are as follows. After completion of this lecture, the students or the listeners will be able to gain knowledge about blood and its component, know about the type of blood group, and learn about the procedure of blood transfusion. For the objectives, now moving further with the content. So contents are as follow. Firstly, we'll start with the introduction and then definition of blood, terminologies of blood component or transfusion, and then type of blood groups. We'll see about the definition of blood transfusion, purpose, indications, selection of donor, preparation of articles, steps of procedure, blood components, complication and management while transfusion, and in the end we'll also discuss bibliography and then we will end our lecture with the conclusion. So now let's start with the introduction. So let's start with the introduction of blood component therapy. Blood component therapy is the therapeutic use of blood component rather than the whole blood to treat a specific deficiency, avoid volume overload, and minimize reaction to blood product that are not needed. Now let's learn about the definition of blood. Blood is a connective tissue in the form of fluid that circulates in heart, capillaries, veins, arteries, etc. Now, let's move further and get into the terminologies or know about the terminologies of the blood transfusion. Uh, if we see, there are many terminologies that we use in blood component or blood transfusion therapy, but I have used only three main terms or terminologies. First is antigen, antibodies, and now, let's move further with the blood components. As we all know, our whole blood contains or it is divided into two parts. First is plasma and second is formed elements, which are further subdivided into different types or different categories. The formed elements contains three main parts. First is leukocytes, erythrocytes, and platelets, which means white blood cells, red blood cells, and platelets. Whereas the plasma contains amino acids, nutrients, proteins, gases, electrolytes, and nitrogenous waste. Now, moving further with the type of blood group. The type of blood groups are A, B, O, and AB. Move further with the blood transfusion definition. Blood transfusion is the transfusion of blood or its component through intravenous for a therapeutic purpose. Now, moving further, let's see about the purpose of blood transfusion or what are the uses. First, to increase the circulating blood volume, to increase the number of RBCs or to maintain hemoglobin level, to provide plasma clotting factors to help in controlling bleeding, to combat infection due to decreased or defective white blood cells and antibodies. Next, we will see about the indications of blood therapy or blood transfusion. Mainly, blood transfusion is done if there is any major surgery or in case of trauma or hemorrhage, if there is any case of severe anemia, hemophilia, leukopenia, and agranulocytosis. Moving further, let's see about the selection of the donor or what are the criteria of donating blood. Firstly, the donor should not be suffering from any sort of disease. The donor should not have donated blood within previous 90 days and the donor should be healthy and should be in the limit of age group of 18 to 65 years. The donor should not be pregnant. The hemoglobin level of the patient should be above 12 grams and the vital signs of the patient should be normal and the patient should not be empty stomach. Now let's start or let's continue with the procedure. Procedure is divided into three parts. First is preparation of the recipient, second steps of procedure, and third last one is aftercare of the procedure. First we will start with the preparation of recipient. Firstly, before doing any procedure, we will go through the doctor's order and we will check for the doctor's order for prescribed procedure, and then we will explain the procedure to the patient, like what we are going to transfuse, either the whole blood or the component of the blood. And then we will also explain that why we are going to do this procedure or why we are going to transfuse blood. Secondly, we will ask the patient if they have any previous history of blood transfusion. We'll ask the patient if he or she may have experienced any sort of reaction while blood transfusion previously, and then the written consent from the patient or relatives. And then we will start with the procedure. We will give the patient the comfortable position and we will administer the blood to the patient. Before administering the blood, we will check the vital signs of the patient and we will offer the bedpan. And if the patient is able to walk or go to the washroom, use the washroom, then we will insist the patient to use washroom. And then we will ask the patient to report any sort of reaction like chills, headache, itching, rashes immediately during the overall transfusion. Instruct the patient to report to the assigned nurse if he or she experience any sort of itching, difficulty in breathing, back pain, chill or fever. Next, we will see the preparation of the articles, or what are the articles that we are going to use for transfusion of blood. So firstly, we will have a tray which will contain blood transfusion set, a Macintosh with cover, a tunicate, cotton swabs with antiseptic, gloves, a kidney tray, paper bag, IV stents, normal saline, blood, and lastly, we will use blood or any of its component that we are going to transfuse to the patient. On the other hand, we also have the rationale of the articles that we are going to use. Next, moving further with the steps of the procedure. Firstly, to prevent any sort of cross infection, we will wash our hands and wear gloves, and then we will identify the accessible vein. We will check if the vein is prominent, if the patient is. After doing hand wash and wearing gloves, we will identify the accessible vein through which the transfusion of blood or component will be easier. And next we will check the bag of blood or the component, bag component, about the RH type, expiry date, and we will also expect for abnormal color, cloudiness, clot, or excessive air present in that bag. And then we will open the sterile packing of the blood transfusion set and insert the transfusion set into the bag of blood. If the patient has IV infusion, we will check whether the needle and solution are appropriate to administer the blood. The needle should not be 18 or 19 gauge, and the solution. And then we will check if the patient has the IV infusion. If the patient already has the IV infusion, we will check that the cannula that we are going to use should be only 19 or 18 gauge. We will place the tunicate 10 to 12 centimeters above the insertion site, or by us, and then we will ask the patient to make a fist. And then by making the fist, it will restrict the amount of blood flow. It will make the veins visiting the patient to clench a fist. Why we will do it? To make the veins visible, and then we will clean the site of insertion using a spirit swab. And then we will begin with the transfusion. Rate or the adjust rate of flow should be 2 ml per minute in the starting 15 minutes, and we will instruct the patient to observe any sort of reaction if he or she feels any sort of chills, headache, body ache, fever, and if they feel the same, they are supposed to inform to the sisters assigned to them. And next, we will monitor the vital sign of the patient in every 15 minutes or every hour and observe the reaction changes in patient's body. After completion of the overall transfusion of the blood and component, we are supposed to remove and dispose the gloves as per the BMW rule, and then record the administration of blood, the date of administration, time of administration, blood group, any adverse reaction if it has occurred, and the amount of blood which we have infused. Now, this is the guideline which we use research center for blood components, which includes component description, indication, dosage effect, special consideration, not indicated for or restricted for, and the next one is shelf life, and last one is the storage conditions. We'll see the blood components. Firstly, the whole blood transfusion. Generally, it is indicated for the patient who needs both increased oxygen carrying capacity and restoration of the blood volume. Second, packed RBCs or red blood cells. It is supposed to be transfused over 2 to 3 hours if the patient cannot tolerate the volume over a maximum of 4 hours. It may be necessary for the blood bank to divide the unit into smaller volumes. Next is platelets. Administration of platelets is as rapidly as tolerated. Each unit of platelets should raise the recipient's platelet count of 6,000 to 10,000 cubic millimeter. Next is granulocytes. It may be beneficial in selection population of infected severely granulocytopenia, patients not responding to antibiotics therapy and who are expected to experience prolonged suppressed granulocyte production. Next, plasma. Fresh frozen plasma should be administered as rapidly as tolerated because coagulation factors becomes unstable after thawing. Albumin, cryoprecipitate, factor 9 concentrate. It is indicated for treatment of hemophilia B, which carries a high risk of hepatitis because it requires pooling from many donors. Factor 12. It is indicated for the treatment of hemophilia. Heat-treated products decreases the risk of hepatitis and HIV transfusion. Prothrombin complex. We will see about the complications of blood transfusion. First is acute reactions. What are the acute reactions that patient will experience during the procedure or during the transfusion of the blood or component? First is allergic reaction. What are the things that we are going to observe are flushing, itching, rashes, asthmatic wheezing, laryngeal edema, and anaphylaxis. Next, what are the management? Management includes we will immediately stop the transfusion. We will keep the vein open and we will keep it and clean it with the normal saline. We will give antihistamines. Observe for any sort of breathing difficulty or breathing distress. If the clinical manifestation or if the sign and symptoms increases, the transfusion can be hemolytic reactions. These are the clinical manifestations that we are going to observe in a patient, like fever, chills, lower back pain, feeling of head fullness or headache, tachycardia, tachypnea, hypotension, vascular collapse, and bleeding. And these are the managements that we are going to do if there is non-hemolytic febrile reaction. Clinical manifestation will be not that hard. It will only be fever, chills, headache, flushing, and anxiety. For the management, we will stop the transfusion and send the blood sample to the blood bank. We will collect the urine sample for testing. We will check the temperature of the patient if there is any complaint of chills in every half hour. We will give antipyretics as prescribed by the doctor to treat the symptomatic to treat the condition symptomatically. Next is circulatory overload. These are the manifestations, and in septic conditions or in septic reactions, these are the clinical manifestations that we are going to observe into the patient. And the management includes, like we have learned before, we are supposed to stop the blood transfusion. We will obtain the cultures of the patient's blood and return the blood bag to the bank and treat septicemia as directed by the physician. I'm concluding my lecture. The result of transfusion therapy are usually rapid and positive. Blood volume is expanded, missing factors are replaced, clotting problems are corrected, or immunity is improved. In some cases, the patient may need multiple transfusion to reach the desired effect, like in severe condition of anemia or severe condition of blood loss. And these are the references that I have used for completion of my overall lecture.